Thank you, Mr. President. This is a great opportunity to be here with you and your team. Dr. Oz has been a tremendous asset. The $50 billion commitment to rural health transformation is critical. New York State is going to see about $212 million in the first year, which is vital for workforce development, access to care, primary, behavioral, maternal, emergency, telemedicine, et cetera. How were we able to do it? Because we rooted out waste, fraud, and abuse in the system. Democrats will just say we cut $1 trillion in Medicaid. That's not what we did. We said you need to be eligible. You need to be a citizen. You need to work if you are able-bodied without dependent children. We reined in the provider tax and state-directed payments, which have exploded over years. And we are taking this money, not only preserving Medicaid for the IDD community, our seniors, our children, our single mothers, but we're investing it in rural health. When you look at Obamacare, health insurance premiums have risen 96% since Obamacare took effect. Insurance revenues up 2,000%. Mr. President, you are 1,000% correct that the insurance companies are the problem. They wrote Obamacare. It's to their benefit, and the American people are being screwed. And so we can get a bipartisan agreement on what you are trying to do. When it comes to lowering drug prices, I will tell you, one of the largest pharmaceutical companies is in my district in Westchester County. I met with them in 2024, and I said, what would you do to lower drug prices? And the response was, go after the European price controls. You are spot on taking on the price controls that have been put in place. Most favored nation is the single best thing we can do to lower prescription drug prices here in America. The pharmaceutical companies will tell you that privately. And that is the fundamental fact. We need to go after PBM reform. Associated health care plans, we put that on the floor. Every Democrat voted against it, every Republican for it. Those would reduce costs by 11% because businesses, small businesses, would be able to pool together and purchase health care plans at a lower rate. We need to go after the PBMs and make sure that insurance companies are not owning providers and owning PBMs. That is what is driving up the cost of health care in this country. You've talked about IVF. I've been a big champion on this. We need to make sure the insurance companies cover it. I also have a tax bill to provide tax incentives to Americans, and what you have done to lower IVF costs on the drugs is critical. And you are 1,000% correct on expanding HSAs. I fundamentally believe that we can address the issues with Obamacare, make sure that the American people have access to care at a lower rate. We can get a bipartisan agreement to address the EPTC with expansion of HSAs so that the money goes to the people and not the insurance companies. We are committed to working to get this done, and I thank you for your leadership.
Thank you.